During a busy morning handover at the psychiatry unit where I work, a young doctor approached me with a question. He asked, "Doctor, do you believe in witchcraft?" These questions came out because of a very complex case we were discussing. A patient experiencing fits that made everyone wonder if it was just mental illness or something else. What made it even more complicated was what the patient's mother witnessed herself. She saw a lightning flash in the sky during a dry, clear day. No rain, no storm, just a sudden bright flash. That all happened after they had visited a witch doctor who told them they would witness a sign in the sky, a signal that the patient's condition was caused by witchcraft. We have a patient with unusual experiences, a mother who claims to have seen something inexplicable, and a young doctor confused about what to believe. It made me realize the confusion between mental illness and spiritual force. It's not just present in general public, it exists even among health professionals. What would you think if you saw that? Or as a professional, what would be your first explanation? And as a person, how would this affect your belief in this case? I want you to keep these questions in mind as we go through this video. Comment please below your thoughts. Is this witchcraft? Is this coincidence or something else? Let me first introduce myself properly. I'm Dr. Batista, psychiatrist, and today I want to talk to you about how sometimes mental illness gets confused with witchcraft, especially conditions like schizophrenia. Before we judge or label, let's take a moment to understand what could really be happening. In communities where access to mental health education is limited, it's common for symptoms of schizophrenia to be misinterpreted as a spiritual vision, signs of witchcraft, or even possession. But what if there is a medical explanation behind this mysterious behavior? Let's take a closer look at schizophrenia, one of the most misunderstood mental health conditions. Schizophrenia is a serious brain disorder that affects how the person thinks, feels, and behaves. The symptoms can be severe and often misunderstood, like I said, especially in places where scientific explanations are not known. Before the more obvious symptoms appear, many people with schizophrenia go through what we call the prodromal phase, an early stage where something just feels off. Family members or closer friends may notice a sudden drop in school or work. They just withdrawal from social life, unusual new interest in religion, politics, or philosophy, fled emotion or strange reactions, difficulty concentrating or expressing thoughts clearly. At first, these signs may look like stress or even depression, but in reality, they could be the very beginning of schizophrenia. When we find this early and act early, the chances of recovery improve significantly. That's why understanding the early signs is just as important as understanding the illness itself. There are 5 key symptoms categories. The first one is hallucinations. These are false perceptions. The person sees, hears, smell, or feel things that are not real, but feel 100% real for them. The most common are auditory hallucinations, hearing voices where no one is there. They may also see people, shadows, light, or other things that others cannot see. Is what we call visual hallucinations. Some even feel sensations on their skin or smell strange odors. In places where spiritual beliefs are strong, those experiences are often interpreted as visions from another dimension, but medically they are caused by brain dysfunction, not spiritual forces. The second one, delusions. Delusions are a strong belief that are not based on reality. This can be very convincing to the person experiencing them. Let me mention example, persecutory delusions, believing others are trying to harm them, persecuting them, plotting against them. Grandiose delusions, thinking they have special powers or divine missions. Somatic delusions, believing their body or part of the body is diseased or not functioning well. Delusion of control, believing that outside forces control their thoughts, their actions, or even the way they are feeling. Delusions of reference, thinking the radio, TV, magazine, strangers even sending secret message to them. Jealous delusion, a strong belief that their partner is unfaithful without evidence. These beliefs are symptoms of a brain disorder. The third one, disorganized thinking or speech. This shows up in the way the person speaks or answers questions. Their speech may jump from one topic to another with no logic, with no link. They may give unrelated or confusing answers. Sometimes they invent new words, is what we call neologism, that not one understands. This can sound like they are speaking in code or in spiritual language, but again, this is a medical condition. The fourth one, disorganized or abnormal behavior without purpose, undressing in public, screaming or laughing at themselves in inappropriate ways, aggression or sudden anger, acting in a strange or unpredictable way. To people who are seeing this from outside, this could seem like a possession. People who are seeing this, observing this from outside, this may look like a possession or a spiritual attack, but it's a sign of brain disorganization. The fifth one, negative symptoms. These are things that person stop doing. For example, lack of motivation to work, eat, or care for themselves, social withdrawal, avoiding people or becoming isolated, flat emotions, is not facial expression or minimal emotional reaction, poverty of speech, is speaking very little. Let's discuss what causes schizophrenia. It's not caused by sin, curse, or bad behavior. Schizophrenia is believed to result from combination of genetic vulnerability and environmental triggers. People with family history of mental illness have a higher risk. Let's briefly look at the brain chemistry involved in this condition. The brain uses neurotransmitters, which are chemicals messengers to transmit signals between neurons and regulate many functions like mood, perception, behavior, and thoughts. In schizophrenia, there is a disruption in the balance of them. One key neurotransmitter is dopamine. Dopamine plays a crucial role in reward processing, motivation. In schizophrenia, while excess dopamine activity in the mesolimbic pathway is associated with positive symptoms like I mentioned before, hallucinations and delusions, negative symptoms are linked to reduced dopamine activity in a different part of the brain, the mesocortical pathway. The pathway connects the ventral tegmental area to the prefrontal cortex, which is responsible for functions like motivation, planning, emotional expression, and social behavior. When dopamine levels are low in the mesocortical pathway, individual may experience lack of motivation that we call dystonia, social withdrawal, blunted emotional expression, difficulty in planning or completing tasks, poor verbal communication called alogia. While positive symptoms may seem more obvious or dramatic, negative symptoms are often more disabling over time and can deeply affect daily functioning. Other neurotransmitter affected in schizophrenia is serotonin. Affects mood, impulse controls, and perception. Some antipsychotic medication also act on serotonin receptors to help stabilize thoughts patterns and emotional regulation. Glutamate, the brain's main excitatory neurotransmitter, is also believed to play a role. Some research suggests that the dysfunctions in glutamate may be linked to cognitive symptoms and disorganized thinking, possibly through its interaction with dopamine pathways. In summary, schizophrenia is not caused by a single chemical imbalance, but rather by a complex dysregulation of multiple neurotransmitter systems. Understanding this helps reduce stigma and highlights the biological foundation of these experiences, moving away from myth or supernatural explanation. Brain imaging shows changes in structure and function also. Drugs use and alcohol can trigger or worsen symptoms in vulnerable people. Stressful-like events, trauma or extreme emotional pressure can also act as triggers. These factors disrupt normal brain function, leading to symptoms we see. Let's remember, when a person sees or hears things no one else does, or believing something that makes no sense to us, they are not crazy or possessed. They may be sick and they need compassion, not judgment, and medical assistance. Understanding schizophrenia means understanding the human brain, and it means giving people the support and treatment they need instead of fear, change, or blame. Let's come back and explain the mother's experience. Now about lightning flash the mother's soul. How do we understand this? Our brains are wired to find patterns and meanings, especially during stressful or confusing times. This is called auto-suggestion or shared delusion, when more than one person experiences it together. It's possible the mother genuinely saw something unusual, but this doesn't necessarily mean it was supernatural. Natural phenomena, optical illusions, or psychological effects could explain it. Now let's address the cultural context. In many cultures, belief in witchcraft is deeply rooted. This can sometimes delay people from seeking medical help because they first look for spiritual or traditional explanations. As psychiatrist, I must respect this belief, but also educate, communicate about mental illness so patients get the care they need. What do you think? Have you or someone you know experienced something similar? How did you respond? Write your thoughts below. Let's start a conversation. It's important to know that schizophrenia and other mental illnesses are medical conditions, not curses or punishment. They can be treated effectively with medication and therapy. Faith and medicine don't have to be enemies. Many patients find strength in their belief alongside professional treatment. If you or a loved one is struggling with symptoms like hallucinations or delusions, please seek help from a mental health professional. Schizophrenia is not a spiritual punishment or witchcraft. It's a real medical condition that affects the brain and can be challenging, but there is hope. With understanding and early intervention and professional help, individuals with schizophrenia can live meaningful, fulfilling lives. Let's replace fear with knowledge and stigma with compassion. Thank you for watching. If this video helped you understand better, please subscribe to my channel and share it with those who might need it. Thank you.